Now let us discuss about the drug aspirin. So normally our body has an enzyme known as cyclooxygenase. So there are two main types in it. One is COX-1 and second one is COX-2. So COX-1 protects the stomach, helps platelet form clots, maintain kidney blood flow, and COX-2 produced during inflammation responsible for pain, fever and swelling, etc. So how does it do? Means this cyclooxygenase converts arachidonic acid into PGs, that is prostaglandins, and TXA2, that is thromboxane A2. So PGs, that is prostaglandins, will are responsible for pain, fever, inflammation, and also protective to stomach. How? That is by product helping in production of mucus and bicarbonate production. So it is also protective to stomach. But this thromboxane A2 causes platelet aggregation and vasoconstriction. So this is all normal things which are happening in our body. But whenever we give aspirin, what happens? It irreversibly acetylates and inhibits COX-1 and 2. As a result, what happens? There will be decreased prostaglandins and thromboxane A2. So effects like decreased pain, decreased fever, and decreased inflammation can be seen. Those are mediated with prostaglandins. So because of decreased thromboxane A2, what happened? Platelet cannot aggregate effectively. So what happened? Blood clot formation is decreased. So it can prevent heart attacks and ischemic strokes. But you have to remember one thing here: platelet cannot make new COX enzyme because they lack nucleus. So aspirin's antiplatelet action lasts for the entire lifespan of platelets, that is nearly 7 to 10 days. Now, what are the uses and adverse effects? Uses like analgesic, headache, toothache, musculoskeletal pain, dysmenorrhea, that is painful menstruation, antipyretic like reducing fever, anti-inflammatory like in rheumatoid arthritis, osteoarthritis, other inflammatory conditions, etc. And antiplatelet action wherever it is required, like in acute MI, prevention of recurrence of MI, and ischemic stroke. And after stent, that is PCA, percutaneous intervention. So it is a non-surgical procedure which is used to open the blocked vessels, the coronary vessels, to restore the blood flow. Okay, that is percutaneous intervention. Adverse effects like GIT, gastric irritation, gastritis, peptic ulcer, GI bleeding might happen, and bleeding time will be prolonged, and hemorrhages might happen. And in hypersensitivity like reactions in bronchospasm can be seen, that is aspirin induced asthma, and rash and urticaria might be seen. And in CNS like tinnitus, ringing sensation in the ears can be seen, and dizziness can be seen. And in children, see, the children who are previously suffering with viral diseases like influenza and chickenpox, this whenever we give this aspirin, it might toxic to hepatocytes. So what happened? There will be hypoglycemia and increased ICP. These all conditions might be there, and it might be fatal. Okay, this Ray's syndrome is fatal, and others like kidney injury with prolonged use can be seen. What are the contraindications? Like active peptic ulcer, bleeding disorders, aspirin hypersensitivity, and children with viral infection, because they might be prone to get a Ray's syndrome, and severe liver disease, severe kidney disease, and third trimester of pregnancy, because premature closure of ductus arteriosus might happen in the fetus, and prolonged labor might happen in the mother. And 1 week before dental extraction, it should be stopped, because there might be like excess bleeding might be there. In the pregnancy also the same might happen, means excess bleeding might happen while labor.